is very important because we have now a lot of treatments with different mode of actions, different benefits, and different side effects. It's very important to have a personalized treatment, so that when we have a patient in front of us, we need to decide which treatment is the best one, the most adequate for this patient. For this, we have a lot of biomarkers. So we have blood biomarkers. We have some prognosis factor, like, for example, age, gender, number of relapses before, which, for example, comorbidities, if the patient wants to become pregnant in a short time, in a long term. So if about the side effects, because some patients, they can tolerate better side effects or not others. So that with all these things, we try to do a more adequate treatment for every patient. And the other important thing is that we need to consider the preferences of the patients and the expectations of the patients. So it's very important that the patients agree with the treatment and share the decision with us, because when the patients don't agree with the treatment, later they don't take the treatment, so that the treatments are not working. So that is very important to share our decisions about the treatment with the patients and to look for the most adequate and appropriate treatment for every patient and in every moment. It could be that a patient needs one treatment in one moment, and it could be that 2 or 3 years later, we need to switch the treatment, to change the treatment, to look for another one. So that one treatment is not for the whole life, and it's very important to adapt the treatments to the situation of the patients.